So we're on to scenario 3 now on antibiotics. Can you see this diagram clearly? I can zoom in a little bit more.
Yeah.
Okay. Can you see what the arrow labeled 1 is pointing at? So this arrow here.
So I think that's like after the incubation, there's where the bacteria are present within there, because obviously the agar plate will contain all the nutrients required for the bacteria to grow, and the incubation will provide the right temperature for it to promote that growth. Then arrow 1 points to where the bacteria is growing.
Yeah. Okay. We'll move on to the next question now. What is the arrow labeled 2 pointing at?
So that's going to be the opposite of that. So that'll be the zone of inhibition, where the antibiotic has prevented the bacterial growth. And it's basically the antibiotic is killing the bacteria by preventing growth, division, and replication.
Okay, great. So that was the answer to the next question. So we'll move on to the question after that. Which of these is the best antibiotic and why?
So the whole principle to this is like the idea that the larger the zone of inhibition, the more bacteria have been prevented from growing. So we're looking for the antibiotic with the largest zone of inhibition. Therefore, it's going to be C.
So in the previous few questions, the candidate shows good knowledge about this diagram, about this experimental structure. We mentioned the zone of inhibition and the principles behind that, and what exactly that means for the experiment in front of you. This is a really good Oxbridge answer. It takes you from what you know about the experiment, what you're seeing in front of you, adopts the principles and explains what they mean. That's essentially the structure that you should adopt for every type of question, at least at the start when you're presented with a new diagram for the first time.
What makes a successful antibiotic?
One that's quite targeted to a specific bacteria and not the host. One that will target a specific function that the bacteria needs to replicate and survive. So one that is ideally one that kills the bacteria as well as preventing its growth. One that doesn't affect host bacteria, and one that doesn't gain resistance quite easily would be quite good, because obviously antibiotic resistance is a big problem.
So here the candidate gives actually quite a good and long list of things that we might want an antibiotic to do, targeting a specific bacterium, targeting a specific function, essentially killing the bacteria rather than preventing its growth. Now the terminology for that is bactericidal versus bacteriostatic, but that's not really important. The key thing is that they mention it. Now what's missing from this answer is a bit more of an appreciation about the pharmacokinetics of an antibiotic. What we've essentially been talking about so far is the pharmacodynamics, essentially what that antibiotic is targeting, how it's doing its job. The pharmacokinetics talk about the actual logistics of how it gets there in the first place. So for example, we want an antibiotic which is easily absorbed from the gut. We want an antibiotic which has a high volume of distribution. We want an antibiotic which is not too toxic at high levels. In other words, it has a wide therapeutic index. Those pharmacokinetic considerations would have boosted this answer just a little bit more, but already it's quite a comprehensive answer. This is good all in all.
Why is there no zone of inhibition around A?
Maybe, well, first of all, it could be a placebo, so like a negative control where you have like a saline solution or some other type of effect that isn't going to affect it, or it could be an antibiotic that the bacteria has already developed resistance to, and so therefore cannot inhibit its growth.
So I don't have too much to add here. What I would like to point out though is the consideration of a placebo. This shows that the candidate is thinking more experimentally rather than just interpreting a diagram in front of them like they would do in an exam in A-level or GCSE. Thinking about that placebo aspect, it shows that this candidate has done experiments before, or at least is thinking about why A might be important in relation to the other results. So that mention of a placebo is actually a really good and quite subtle important point.
What do you understand by the term antimicrobial resistance?
So antimicrobial resistance is where the bacteria is no longer susceptible, or it can't be affected by a particular antibiotic. And this is done by the process of natural selection. So the presence of the antibiotic leads to the development of resistance genes, which then further lead to more selection of that specific gene until the colony is fully resistant.
So again, not much to add here, but here we have a big red flag in my opinion. The candidate starts to talk about the development of resistance and says that the antibiotic leads to the development of resistance genes. Now, this is very vague and sloppy terminology. In fact, the resistance genes were probably already there as a result of a mutation. What the antibiotic does is apply a selection bias to that bacterial population, and as a result leads to the competitive advantage of those that have resistance to allow them to have more space to essentially replicate. So all in all, this answer is good, but it does have a few red flags there in terms of their understanding of antibiotic resistance. So when you're talking through a concept like this, just be careful about what you're saying, because one wrong word can really turn the interviewer away from picking you.
How can we combat antimicrobial resistance?
So we can do that by decreasing the use of antibiotics, making sure the antibiotics that we use are selective to the disease that we need them to be effective against, developing new antibiotics, but obviously that's going to be a slow process and it's going to be a bit slower than the actual process of antibiotic resistance developing, making sure patients finish their antibiotic course, because I think that there's a lot of problem with that.
Now the candidate finishes on a strong note here. They talk about decreasing the use of antibiotics. They tend to talk about the selective use of antibiotics, encouraging patients to finish their course, as well as developing new antibiotics. And it's nice to consider that they're thinking a bit more generally about this, because when they say about developing new antibiotics, they say that this would take a longer period of time. Now, what I would like to see is this candidate pushing themselves a little bit more. When we talk about limiting the use of antibiotics, where are we talking about that? Is that in hospitals? Is that on farms? Because farming is a really big area of antibiotic resistance work as well. So all in all, I'd like to see this candidate push themselves a little bit more. Even, for example, when they talk about patients finishing their course of antibiotics, how are we going to do that? Maybe it's better patient education. Maybe it's better training of doctors in the first place to allow them to consider that aspect. So all in all, the logistics and just pushing a little bit further about how we achieve these things would be a really good answer in this case.